Good morning. My name is Joe Wright. I'm CEO of Encompass Health Services in Page, Arizona. We've been asked to, as an agency, put together a small video presentation on what integration and integrated health services means to our organization. So our leadership team got together and started thinking, instead of listening to administrators sit and talk about what integration means to our organization, we thought we would do a video presentation with a wide variety of multiple disciplines within our organization and have them explain to you what integration and integrated health care means to our organization. I hope you enjoy the presentation. It's not very long. I think one of the things that you'll hear when you listen to the presentation is that integrated care is just ingrained on our heads, on our foreheads. We know what integration means, and it's from the top to the bottom in our organizational chart, and that's taken some years to get us to that point. But I think that we're there, and I think that the presentation that you see will hopefully show you that. Hope you enjoy it. Thanks.
Okay, integrated care in a nutshell is a phenomenal concept because it focuses on total health, not just one side or the other. It combines behavioral and mental health in a very cohesive fashion. It looks at the whole person because the more you get into it, the more you realize that medical and behavioral health go hand in hand all the time. It's the most multidisciplinary approach I've ever worked with in my life, and I think it's phenomenal.
To me, it means being able to take my clients to their primary care doctor appointments so I can sit in and listen to what the primary care doctor has to say, so that way I can explain better to them later on and also get the information back to their primary counselor, and I can also advocate on the client's behalf with their primary care physician.
It was a specific time. We've had many times, but this one in particular was recent. Was caught with a bag of meth. It fell out of his pocket and someone brought it to me and said who it came from, and I was devastated when I found out who it came from. And he is like so majorly important to us, and now I know why he was this Energizer bunny, because he put in many hours beyond anyone else, and I'm like, man, this guy's inhuman, you know. Now I know why. So I told him, you don't have a choice, you're getting tested. So I brought him in, and he tested positive for meth, and it just was devastating. Well, my son-in-law, who owns the company, his first thought was to fire him, because that's what we do. And I went, no, man, we can't do that. Let me call Joe. We got him into the medical part. They did a whole series. Demagon did blood work like mad. This man was in physical bad shape. Diabetes, all kinds of things was going on in this body besides the meth use. And so then Joe got him his people here, the counselors, the people that were set up to help him, and he went through a couple and he matched up with one that was amazing. And this one, she understood him, he clicked with her, and they went with that. And it was amazing that she just kept working with him, going a lot at first, tapered off a little. We monitored him. Demagon got him on medications, high blood pressure, things like that, to get his body. He went through all the withdrawals, which we all went through, which was awful. And we spent a lot of evenings with him. A couple times in the hospital, we went and sat with him in the hospital because he had to be hospitalized several times. Hit rock bottom, came back up, and he's tapered off, but still goes, has his counselor. When he feels like something's bad, he comes into me and he says, man, last night I could have really used something, but I didn't. I just wanted you to know that.
Integrated healthcare, I think, is the best care. I moved from a bigger city and I've never seen anything like it before. It's so amazing that we have chiropractic care, massage, we have medical providers along with behavioral side, counseling and crisis, that our patients can get care on both ends of the spectrum no matter where they're at. And we can do it all sometimes in the very same day, and they don't have to come back and forth and back and forth. It's pretty amazing that we can offer these type of services to our patients.
Hi, well, taking care of my patient's medical needs, addressing her blood pressure, her temperature, her vital signs, her medication refills, can also address her need for anxiety. And if we are in the clinic room and a patient requests help with depression or anxiety, we can walk them directly over to our behavioral health resources and help them to meet with a counselor or a crisis counselor if they need immediate attention to get the right resource to the patient at the right time. So when the patient expresses a need, we take care of that need in a very timely manner. That's integrative care for us.
Integrated care to me means that when you come to get health care, not only can you go into a building where you have your medical needs met, but you also have your behavioral needs met. And it happens seamlessly. And the facility itself has worked out their processes so that they're aggressively making sure that each of their patients get both their behavioral and medical needs met. What that means is you have to have both sides talking to each other so that medical can share with behavioral what's important for somebody's physical health, and behavioral can communicate the same things with the medical, what's important for their behavioral health. So I see patients getting tested for, all the patients that come here would be tested for anxiety, depression. Is there any domestic violence in the home? A lot of things that, alcohol or drug abuse. All of those things we should be screening for aggressively on the medical side and behavioral side. And then vice versa, if you have somebody that's presented to behavioral for depression or stress, schizophrenia, whatever they're being treated for, the behavioral side knows that the physical needs need to also be taken into account for these patients. Are they being screened for diabetes? Are they being screened for their cholesterol, hyperlipidemia? Do they have blood pressure issues? Is their weight or body mass index out of control? So you have both physical and behavioral issues being addressed aggressively within the facility, so people don't fall through the cracks on either side of their health.
At Encompass, integrative care means that both prescribers can talk to each other, they can exchange information, they can design a program that's a dual plan to treat the entire person. So not only do you get alternative type recommendations such as the yoga and the chiropractic, but we also integrate both how the medicines work for the physical body as well as the mental health body.
I'm Malin Bunting. I've been with Encompass for about 13 or 14 years. When they built the medical side of Encompass, I immediately went from my old doctor over to Encompass because I felt that it would benefit me both mentally and physically to have both the mental and physical part of my health care taken care of over there. And it's been a great benefit to me. I can see it being a great benefit to a lot of other people.
I had a patient come in one day here at the medical side, looked very distraught. So I went to the patient and they told me that they had tried to commit suicide the night before. I told them that I was so glad to meet them on this day, and was so glad that they were here, and was able to walk them next door and give them to a crisis counselor who was able to then immediately start helping them. They got the help that they needed, and as it turned out, some of the help they needed was medical. They had chronic back conditions and soreness that was really making them miserable. And today I get to see that person on a regular basis, and they're healthier and they're happier, and it's so nice to be able to know that I work in a place that I can get all the help I need for any patient that walks through the door.
Integrated care is not just about having both parts of healthcare. It's more about having access to records, case managers, and actually getting patients seen on both sides and taking care of the whole patient. If we share the information, it makes it much easier.
Integration has evolved beyond a building. It's in our philosophy and our approach to care and expansion, as with the Growing Great Minds Garden project. Integration has allowed us to create new programs like our diabetes magazine. the Healthy Living Chronic Disease Management Program, and our latest program, WOW, Want It, Own It, Win It, Weight Loss Program. Integration has allowed us to think outside the box for each of our patients. We now can encompass all of healthcare, and our options are limitless. There are barriers still, like an integrated, functioning EMR, as well as the time and funding to implement it. We are making a difference, and our results can be seen in our quality measures, in our integrated programs, and the number of dually enrolled patients that utilize our integrated resources. We have attained meaningful use for both year 1 and 2. We offer Tai Chi, yoga, and chronic pain programs. We are tracking population health and are looking to future telehealth expansion. We may be in frontier country, but with integration, we can focus on treating the patient as a whole. We have seen the results with lowered medication usage, lower hospital admissions, and a healthier patient population.
What's going on, guys? My name is Al Neasy, and I'm one of the board members for Encompass, and I was asked to share a little bit about how I see Encompass impacting our community and the surrounding areas. Just a little background on my connection with Encompass. I was on staff not too long ago, and I was what you will call a prevention specialist. And I was based at the high school, and I dealt with, or I worked with, a lot of at-risk students. And we focus on self-esteem, we focus on decision making, we focus on self-control, and so many other elements. And what I truly love about this organization is that their goal is to impact the whole person. They love focusing on the whole person overall. And I like to think that they specialize in the SSB, which simply means spirit, soul, and body, the whole person. I mean, check this out. Close your eyes and imagine, who would ever have thought about combining a behavior health center with a medical center? That's like a one-stop treatment center, baby. You know what I'm saying? That's what I'm talking about, impacting the whole person, the SSB. You hear what I'm saying? Impacting the whole person. I mean, I'm here to tell you that Encompass is here to get you thinking a little different, okay? Encompass is here to encourage you and to build up a person's spirit. Encompass is here to get you to start feeling better physically. Why? Because they want to see you live life to the fullest. That's what you deserve, you know? And the bottom line is, people, they get it.